Hello, dear doctors, and welcome to this small session today. This is Dr. Sahar Ali. I am working in the NHS in acute medicine unit. I am also a simulation faculty for the junior doctors in my trust. I am the founder of PLAB2 Warriors groups. In these groups, I do provide PLAB2 Warriors courses, PLAB2 Warriors 1-to-1 mocks, and free mocks as well. And all of them, alhamdulillah, are rated as outstanding. These are some of the wonderful success messages from the candidates of the courses and the mocks as well. Hopefully you celebrate your pass very, very soon, either by taking the course, the mocks, or with any other courses, or even without any course. You can have a look quickly. All right. In terms of my courses, I do have the full course and the practical course. In the courses, you will find high fidelity simulated scenarios. All of the scenarios are done by me in 8 minutes using the GMC bill. So you feel the pressure of the time and the pressure of the exam condition as well. In the practical course, I use the SimMan and the monitor so you can feel the pressure of dealing with acutely unwell patient. Also, I use the mannequins to do the examination on them, teaching cases as well. In the course, I use my lovely mind maps. All of the candidates love them. As you can see, they are very organized, systematic, easy to remember mind maps. They are divided in 2 halves, as the case should be done in the exam, half for the data gathering and half for the management. In the data gathering, everything that you need to ask in each category is written. The second half is for the management, giving the diagnosis and the management points. In the diagnosis part, you will find a suggestion or an idea about how to deliver the diagnosis for each specific case. All right, this is my YouTube channel. You just need to click on the playlists to find out the helpful playlists. For my videos, I do have 2 playlists. The first one is the marking criteria, and the second one is for the free mocks. All right, let's get started. This is my first video to help you out in understanding and passing this exam, God willing. This is a very important video before you start studying and even after you finish. It is also important for the repeaters because most of you rush to practice without even knowing these important points, and this is a big mistake. One of the main reasons of failing in this exam is that the candidates do not know what PLAB2 test is about. So, do we really know what PLAB2 test is about? To answer this question and to find out the missing pieces of puzzle and to know the secret, we need to know how they mark and what are the aspects that they are looking for. I am going to talk today about 2 main points. Firstly, what is PLAB2? Secondly, the marking criteria. So, what is PLAB2? It is the short form of Professional and Linguistics Assessment Board. Professional means that they assess your professionalism in dealing with your patients and your colleagues as well. Linguistics means that this exam involves assessing your language in a simulated scenario. Yes, your language. They assess your reading, writing, listening, and your speaking as well. In reading, they assess your ability to read your question and your task. They keep bringing almost the same question, but they change a specific thing in this question. Based on this thing, the approach will be different. So, they assess your ability to read your question and the task carefully. In writing, they assess your ability to write. For example, writing prescriptions or respect form. In listening, which is one of the main issues in this exam, they assess your ability to apply the active listening. Active listening means picking up the verbal and non-verbal clues. Verbal is everything the patient says. Non-verbal is everything the patient does. Everything the patient does or says has a value, and you need to respond to it. As an example for verbal clues, let's say that we have a patient and this patient keeps saying, "I am ugly." Anytime I saw myself in the mirror, I see myself ugly. This is a verbal clue. So you should respond to this verbal clue. You can say, "Why you are saying something like this about yourself? You are not ugly at all. You are far from ugly." Alright? So you can respond to that. You can show your ability in dealing with these verbal clues. Okay? In terms of the non-verbal clues, let's take an example for that. Maybe you have a patient. This patient keeps itching in front of you. You have to pick up this non-verbal clue and tell him, "I can see that you are uncomfortable. I can see that you are itching. Is everything all right? Do you need any kind of medication to ease that?" All right? If you don't do this, you don't have this ability to pick up the non-verbal clues. So you have to pick up the verbal and non-verbal clues. All right. In speaking, they assess how is your way as a professional doctor will satisfy the patient. So you have to have very nice and high interpersonal skills with your patients or with your colleagues. All right? Also, they assess your body language, your head nodding, your eye contact, your use of hand, your tone of voice, and your confidence. This exam is an OSCE exam. It doesn't focus on testing your knowledge or your ability to recall the information, but it focuses on your ability to deliver this knowledge to the patient in an interactive conversation. That's why I focus on that in my course. The second aspect is how they mark. There are qualitative and quantitative marking criteria or sheets. Let's take first the qualitative mark sheet. They test you in 10 skills areas. The skills areas reflects your actual performance. So please, when you practice with your partners, ask them to assess you according to this sheet. Let's explain them so you can use them in your practice. The first one is consultation. In consultation, you should have a logical, organized, jointed consultation. Also, you have to do the relevant examination and the relevant investigations. If you have a defect in any one of them, so your consultation is poor. You may ask everything, but in a haphazard way, in disjointed way. Your way in asking the questions is not logic. If you do this, you will have a tick. Let's take an example. We have in our history taking 5 main categories: present history, past history, personal history, 4 Ps, and psychosocial. You have to go smoothly from the present history to the past history to the personal history to the psychosocial. Then you can ask ideas, concerns, and expectations. This is the organized, jointed way of consultation. If you go between these categories back and forth in a haphazard way, so you have a poor consultation. Let's take another example. If you are in the present history, you are exploring a specific symptom. Let's say that this symptom is pain. The patient is presenting with pain. You start to explore the pain, but in the middle, the patient says another symptom. You go with this second symptom, then you come back to the exploration of the first symptom again, which is the pain. By doing this, you are not having the organized way of thinking. It's better to bring the patient back in a polite way. You can say to him, once he tells you the second symptom, you can tell him, I'll come back to this point in a minute if you don't mind. I don't want to miss any important thing regarding this symptom. And then you can continue exploration of the pain. After that, you can go to the next point. Please remember that you should be the leader of the consultation. Alright? Also, when you forget to ask an important question in your history taking, try to avoid saying, oh, I'm really sorry, I forgot to ask this question. It is really important for me. Actually, this is not proper, alright? You can say it in another way. You can ask this question, which that you have forgotten. You can ask it in unnoticeable way by asking the patient, can I confirm with you? Maybe let's say that you missed asking about driving. You can ask the patient, alright, can I confirm with you? Do you drive or not? Okay? I think this is a better way, isn't it? Alright. The next one is the issue. If you have a tick in the issue, this means that you missed the main issue of the station. For example, a patient who is coming with chest pain. This chest pain is heart attack. It is not proper to ask about the lifestyle. Do you eat healthy? Do you exercise? Do you smoke? Do you drink alcohol? The patient is in heart attack, which is an emergency situation. Asking about lifestyle is not the issue of this station. The issue is treating the acute pain, is treating the heart attack. Alright? So please avoid missing the issue. Let's take another example. A patient who is presenting with a renal colic. The patient is in pain. If you're in the management, start to tell the patient the first thing is referring the patient to the specialist. This is not the logic way. You are an FY2 doctor and your job is stabilizing the patient. The patient is in pain, so it's appropriate to say firstly, we will keep you in the hospital and observe you until the pain subsides, and then we will involve the specialist. The specialist will come and examine and assess you and do their further investigations. So it's important to be organized in your thoughts, in your management. Okay? This is regarding the issue. In time, if you have a tick here in time, this means poor time management. It means spending time in the less important things. It's not purely about finishing on time. It's about asking the most important things and mentioning the most important points within 8 minutes. Alright? Let's take an example. If we have a patient who is diagnosed with cancer, the patient's son doesn't want you to tell her about this cancer. Alright? So the most important points in your data gathering in this specific case are what? Are knowing why he is asking for this and asking about the psychosocial part as part of the rapport with the patient or with the relative. This is the important data gathering. So it is not appropriate to ask about if his mother is having any medications, any medical conditions, or any allergies. This is not the important thing here in this context, in this situation. Alright? So spend your time in the most important things, either in the data gathering or in the management. Let's take another example. Let's say that we have a patient. This patient is coming for her test results, and the test results are showing bacterial vaginosis. Is it appropriate to ask about the discharge? How much discharge? What is the amount? What is the color? And these things? It is not appropriate. The patient is already diagnosed. You have the results. It is bacterial vaginosis. So the most important points in this particular case is asking about the risk factors. Ignore the discharge, ignore exploring the discharge because the patient is already diagnosed. But you can't ignore the risk factors. You have to find out what are the risk factors to address them in your management. Alright? Findings. If you have a tick in findings, this means that you did not recognize a finding in history, in examination, or in the investigation part. Let's take an example for this. Let's say that we have a patient. This patient is coming with urinary incontinence. And we all know that one of the risk factors of urinary incontinence is the high body mass index. So the first thing, or one of the main lines of treatment in this case, is mentioning the high body mass index and advising the patient about lowering the body mass index or losing weight. Some of the doctors ignore asking about the body mass index in the examination part, and if the examiner give them as a finding high body mass index, they also ignore that in the management. They don't say, I have found that your body mass index is on the higher side, and one of the main lines of treatment in your case is lowering the body mass index and losing weight. They don't say this, and they talk about referring the patient to the specialist and surgeries. Okay? So you missed an important finding which will help in the management. Okay? This is regarding the findings. The next one is examination. You may have a defect in the examination or in the procedure. You may also don't do the steps of the examination or the procedure confidently. If this is the case, you will have a tick under this area, under examination. Okay? Diagnosis. If you have a tick in diagnosis, this means that you gave incorrect diagnosis or inappropriate range of diagnoses. With regards to giving incorrect diagnosis, as an example for this, let's take an example. A patient who is septic. The patient is having sepsis. The monitor is showing hypoxemia, hypotension, and fever. So the most probable diagnosis is sepsis. The correct diagnosis here is sepsis. Sepsis due to any kind of infection. Some of the doctors diagnose this case as an infection. This is not correct, right? And it happens. It happens in the exam due to the stress, right? Try to avoid the stress and try to be alert, alright? The management. If you didn't give a management plan, if you didn't mention the follow-up, if you didn't safety net the patient when it is needed, you will have a tick here. So always give a plan first. Give a framework, give an outline of your management, then you can talk in details. Try to avoid telling the patient, we will do this, then we will do this, then we will do this. This is a kind of reciting the management part. You have to have a discussion. You have to discuss the management options with the patient in an ideal conversation. And that's why I teach that in the course, because it is one of the main important things in the management. It's always be better if you give a plan, an outline, or a frame first, then talk in details. Whatever your outlines are, you can tell the patient, let's talk about what we can do and what you can do for yourself. Let's talk about the medications and lifestyle points. Let's talk about the medical and non-medical treatment. It's based on your preferences. Some doctors just try to put the management in main points or the main points that they want to talk about, then they talk in details. So it is always proper to give a frame first. Alright? Rapport. If you have a tick in rapport, this means that maybe you were not patient-centered, you were doctor-centered, maybe you didn't seek the agreement of the patient on the management plan, maybe you didn't have this enough sympathy and empathy in specific situations, maybe you didn't address the concern of the patient properly. Being patient-centered means designing a management plan which suits the patient's circumstances, the patient's situation, and the patient's feelings toward his disease. You may have in real life 10 patients with the same disease, but the management plan will be different based on each patient's circumstances and situations. Some of the patients will be concerned about the work. Some of the patients will be concerned about the medications. He doesn't want to take the medication. Pills. He doesn't want to take pills. So you need to find out another solution for this. Some of the patients don't want to do a specific investigation. So you have to design the management plan based on each specific case. This is what is the meaning of patient-centered. You treat every patient based on their situation. All right? You have to put the patient in the center of your mind. The management should be designed based on the patient, on this human, not on the disease. All right? Some of the doctors just give the treatment, they give the options, they tell the patient, all right, we can start you on these medications and we will do some investigations and we will follow you up without checking if this suits the patient, if the patient wants anything else. Maybe he doesn't want to take these medications. Maybe he doesn't want to to do this investigations. So you have to offer the options of the management and then check, is it okay with the patient? Can he do this or not? Is it applicable for him or not? And so on. Listening. If you have a tick in listening, this means that you didn't pick some verbal or non-verbal clues, and we have discussed that. Language. If you have a tick in language, this means that you were not clear to the patient. Maybe you explained everything to the patient, but you were not clear, you were not simple to the patient, you used medical jargons. Also, you didn't check the understanding of the patient. Sometimes you don't understand the patient himself. If you don't understand the patient himself and there is a misconnection or miscommunication, it will be under the language part. All right? This is the qualitative mark sheet. It is from the GMC website. You can have a look at it just to be aware of the whole picture of this qualitative mark sheet. You may pass a station, but you have a tick in one or more of skills areas in this specific station. This means that your overall performance was good, except in these particular skills. Right? In some occasions, you fail a station and you don't have any tick in this station. This has two possible explanations. The first one is that your skills were average, but the performance of other candidates was super in relation to you. The second possibility is simply they are human beings, and there is a possibility that they didn't manage to put a tick in this case. Okay? The quantitative mark sheet. You have 12 marks in each station. They divide it on 3 domains: the data gathering, the management skills, and the interpersonal skills. In the data gathering, they mark you on relevant history taking, mentioning the relevant examination, and ordering the relevant investigations. Being relevant is extremely important, and I teach that in each case in the course. In ethics cases, the data gathering is quite different, but this is not our scope today. Okay? In the management skills, they mark you on explaining the diagnosis in a simple way to the patient, on putting a plan or framework. In addition to that, following the patient up, giving leaflets, safety netting the patient when it is appropriate. In the interpersonal skills, they mark you on how you are approaching the station. Did you have a nice rapport with the patient? Did you ask ideas, concerns, and expectations? Did you ask an open question first and then closed questions? Did you have a proper management of the situation? And many things to apply, but these are the most important points for now. This is the mark sheet of the domains of the qualitative, so you can have a look just to be aware of them. Alright? What is the difference between qualitative and quantitative? The quantitative is the score, the marks in numbers. The qualitative, as I mentioned, it reflects your actual performance. Where was the defect exactly in each case? I shared a PDF about common mistakes from the GMC website in the video description, so please read it at least twice. It will help you to know the common mistakes by heart and to avoid falling in them. Right? If you have any query about PLAB 2 Warriors courses, please join our Telegram group. The link is in the video description. You are more than welcome. Alright. Thank you so much, doctors. I hope it was to the point and helpful. See you in the next video. Bye bye.